Fetterman remains off the campaign trail following his stroke last month. There's still plenty of time before November's election, but how nervous should Democrats be? Seth Kaplan joins us now live with more. Seth.
Valerie, his doctor says he'll be fine, but his doctor is also keeping him from campaigning publicly right now. There is perhaps no one in America whose health is being as closely scrutinized right now.
This is, arguably the most important seat
on the ballot in all of America this fall. Jake LaHutte, senior politics reporter at Business Insider, says it's actually true when Fetterman's campaign says no one's terribly nervous right now. When might that stop being true?
And especially we're talking maybe, late June going into July. That might be when you start to hear more chattering among, the campaign consulting class and folks like that.
People who Democrats say aren't worried?
People who are campaigning or regular Pennsylvanians.
ABC 27 Democratic political analyst Danielle Gross says Fetterman's appearance as a regular guy with health problems isn't a political liability.
John Fetterman postponing his own health or putting his own health second is something that sadly, not uncommon. A lot of people find it difficult to manage a chronic disease or to follow doctor's orders.
And if his health doesn't improve?
God willing, it won't have to happen here for the sake of the lieutenant governor, but should he be unable to fulfill his responsibilities as a candidate, then yes, there is a process.
Chip Becker teaches state constitutional law at UPenn in Philly. He says Fetterman could withdraw up to 85 days before the election, and the Democratic Party could replace him on the ballot up to 75 days before. That's late August. Here in early June, Fetterman's cardiologist released this letter saying he should be okay. Fetterman Communications Director John Cavello emphasizing the doctor's statement that Fetterman, quote, should be able to campaign and serve in the U.S. Senate without a problem. Cavello told me anyone suggesting otherwise is, quote, irresponsible and ignorant, that Fetterman is, quote, taking his time but is on his way to a full recovery. Yeah, so you could argue with that. Well, Jake LaHutte of Business Insider pointed out to me Mehmet Oz has a cardiology background of all things, but he said the Oz campaign could risk voter backlash if it were to make Fetterman's health a campaign issue. He pointed out Bernie Sanders had a heart procedure during his presidential run, and Valerie, although he didn't win the nomination, that wasn't the reason why.
All right, thank you, Seth.